everybody, it's Dr. Alex Earl. We're here at Pure Plastic Surgery and it's Hump Day with Dr. Alex Earl. And of course, the time I get to spend with you guys so we can go over some plastic surgery topics and answer all your burning questions, okay? So today I chose a relatively short topic, so we'll kind of get through that here in the first few minutes, and then of course after that, I'll be happy to answer any questions you guys may have, whether it's about this or any plastic surgery topic really. We can talk about any procedure, we can talk about the pre-op, the post-op care, or anything else, okay? And I'll be happy to answer all those questions, and you know you're going to be getting good, reliable information because it's coming from a double board certified plastic surgeon who went to Duke, by the way. All right, so this is a very, very common question that we get. We get it all the time, and I know I've talked about this before. We put it on Instagram, we put it everywhere, and regardless, we still get this question, okay? So the question is, can I combine my tummy tuck with my BBL? Okay, and the answer is no, okay? So that's the short answer. The short answer is no. I do not like to combine the tummy tuck with the BBL, okay? And so then the next question is why? I've heard that in other states they combine it, or I heard in other countries like in the Dominican Republic or perhaps Colombia they combine it, or I've heard I heard some doctor here in Florida is combining it. So of course let's get more into detail then as to why I do not like to combine a tummy tuck and the BBL. So the first thing is lipo limits, okay? Lipo limits. So here in the state of Florida, when you are combining a tummy tuck with a BBL, you are then limited to only 1,000 cc's of fat removal via liposuction. Okay, that is the limit. That's actually written in the rules for office-based surgery. So, and this is a public document that you can look up online. But if you go to the rules of office-based surgery for the state of Florida, it specifically says that when you're doing a tummy tuck, that you can only remove 1,000 cc's of fat via liposuction, all right? So for most patients, that is not a lot, not enough to then divide that and put 500 on one side and 500 on the other for the BBL, for the buttock and hips, and then create basically the shape or the look that they're going for, all right? So in most patients, the 1,000 cc's that we can remove is only enough to remove that from like the flanks and the waist and kind of start contouring that area. But certainly we can't then move on to remove a whole bunch of fat from the back or other areas because we're going to reach that limit very, very quickly. Okay, so that is our limit, and because of that, we're probably not going to be achieving the results that you want from the BBL. Okay, so that's number one. So if you've heard about surgeons here in Florida that are combining the two, and they're not talking about this 1,000 cc limit, then potentially they can be breaking the rules here from the Florida Department of Health, which of course is not good, because if they're breaking that rule, then potentially what other rules are they breaking, and do they really have your best, do they really have you and your safety in mind? Okay, so if you're going to combine it, you definitely have to be talking about this 1,000 cc limit. Okay, all right. The next issue is, of course, the time of surgery. So this will make it a fairly long surgery. So you're doing the BBL, you're doing the tummy tuck, you're combining the two. That can be easily, 4-hour surgery or so. Me personally, I don't like to do anything that's much longer than 3 hours, okay? It is well known, it is well studied that as you spend more and more time under general anesthesia, that, the complication rates can start to go up. Mostly like, for example, respiratory complication rates, and also blood clots, which we discussed last week. Okay, so the more time you're in anesthesia, so the higher the time, then the higher the potential complications from anesthesia. And so I like to, again, limit this to not much longer than 3 hours. We try to be very, very efficient. We can accomplish a lot in 3 hours, but we don't want to be under anesthesia for much longer than that. Okay? The next issue is recovery. Okay? So if you're recovering from a tummy tuck, you have this muscle repair, you have this long incision along here. Everything's, if you're doing the tummy tuck the way, the way that we should and making things, nice and tight, then you're gonna be kind of hunched over like this, right? And you certainly can't be sleeping on your belly. You could not sleep on your belly when you do a tummy tuck. So when you have a tummy tuck, you have to be essentially sleeping on your back. Actually, a lot of times we recommend that you sleep in the recliner, okay? But then of course, if you're in the recliner, you're gonna be putting a whole bunch of pressure on the buttock and hips, which is not ideal for your BBL. Because if you do that, then you could potentially lose a lot more fat than you would otherwise. And so now, you're starting with only 500 cc's per side because we have that limit, and now you're kind of sitting on it. And so of those 500 cc's, you're gonna lose more than the usual 30%, so you're gonna lose a 50% or higher. Then of course, then it really becomes like not worth it. You're not gonna get the results that you want from the BBL portion of the procedure. Now some patients, some may say, well, what if we use like those cutouts and all these things? And sure, I mean, that's a possibility, but you're still going to be putting some undue pressure onto the area. And again, it's not ideal. And the recovery itself is just really, really tough, okay? I think one of the toughest recoveries is the BBL, okay? That's hard just by itself, okay? And on top of that, you're adding a tummy tuck. This can be really, really difficult for the patients. The pain control is going to be an issue. Fluid, staying hydrated is an issue. We're definitely going to have to be checking those hemoglobin levels because the blood loss can be much, much higher. So chances of blood transfusions, having to go to the hospital for either IV fluid hydration or blood transfusions is going to be significantly higher. All right. So recovery is definitely a lot tougher. Okay, and for that reason, I don't recommend it. Okay. Another reason, of course, increased complications. The more stuff you try to do in a surgery, the more things you try to combine, your complication rates are going to go up. Why? Because you're adding all the complications, potential complications of a BBL to all the potential complications of a tummy tuck. It is additive, okay? So the chances of any complication are higher. So complications of infection are going to be higher, all right? The complications of blood clots are going to be higher. Complications of bleeding and needing blood transfusions is going to be higher. Complications of dehydration are going to be higher, okay? So the complication rates are going to go up, which means that patient safety goes down, okay? Patient safety goes down. So again, if you have the patient in mind, you really don't want to combine this, okay? You want to do whatever's best for them in terms of their safety. But of course, not just the safety. I mean, what's it all about? It's about results, right? You want to do what's the best for the results. And when you combine these two procedures, especially for the BBL and the liposuction aspect of it, especially if you're following the rules, you're probably not going to get the results that you want, okay? Because you're limited as to how much liposuction you can do. You're limited as to how much fat you can transfer. And then, you're now sitting on the buttock, putting pressure on the hips. That's going to make, that fat, disappear, basically, get absorbed at a much higher rate, okay? And then, because of that, because maybe you're kind of moving around and everything else, you're going to be putting more tension on the tummy tuck aspect of it. That may cause the tummy tuck wound then to open up or dehiss. You have a wound dehiscence or wound breakdown, okay? That's never good. That then requires, taking care of the wound, potentially a wound vac, okay? And then even if the wound doesn't break down, putting that extra tension on the wound is going to make the scar become much, much wider. So now you're going to end up with an ugly, wide tummy tuck scar, okay? So you don't want any of that, all right? So I think these are plenty of good reasons to not combine the surgery. And honestly, I don't recommend that, not only because I'm here in Florida, but I don't recommend anyone to do this anywhere, really, in any other state or Dominican Republic or any other country, okay? All right, so then once this kind of sinks in, and I think it makes a lot of sense, I think a lot of people now are thinking, okay, that makes sense, let me not combine these two procedures. The next question becomes, well, doc, what should I do first, right? Super common question, what should I do first, my tummy tuck or my BBL? And I'm going to say that for most patients, probably about 90% of patients, I would do the tummy tuck first, Okay? Tummy tuck first. So let's write that down in big letters. Tummy tuck first. Okay? Right? So why is that? Well, the reason you're getting a tummy tuck is because you probably have a couple things going on. You have a lot of excess skin to the abdomen, especially in that lower abdominal area, and you have some muscle weakness or muscle separation. All right. So if you do liposuction first or the BBL first, it's not going to address the skin issue and it's not going to address the muscle issue. So now it simply addresses the fat that's between the skin and the muscle. So then you're going to end up with probably an uneven looking abdomen, okay? Because the skin didn't retract well, the skin is loose, and when it does that, it retracts unevenly, and you're gonna get lumps and bumps and unevenness there. You're not gonna be happy with that. You're also gonna potentially get the skin when it kind of hoods over the belly button. We call that belly button hooding. That's when you get that donut over the belly button. A lot of patients don't like that either. Okay, and they think that it was due to not enough liposuction to the area, and that's not the reason. The reason is because there's loose skin over a fixed point, and then that skin hangs over that belly button, which is a fixed point, and it causes that umbilical hooding in that donut type shape over there. Okay, and then of course, if the muscles are still weak and there's still separation, you're not going to have a flat abdomen because those muscles can't hold everything in. That muscle needs tightening, so you're not going to have a flat abdomen. So you're going to do your BBL. You're going to end up with a early pregnancy still looking belly with loose skin and an unevenness and umbilical hooding, and you're not going to be happy. Okay. And then the other thing is, well, say you do that and you're not happy, and you try to do the tummy tuck after. Now we have all this scarring in there. It makes the tummy tuck much harder. There's all this inflammation, all this scarring. The skin doesn't stretch down as much. It's a lot tougher to get it down, so we're going to be able to remove less skin, and we're going to be dealing with a lot of the scar tissue from the prior liposuction. Okay? So it makes the tummy tuck secondarily much tougher. So once again, for most patients, I would say 90% of patients, I highly recommend doing the tummy tuck first. Now I know there's a myth out there. Here's the myth. Doc, if I do the tummy tuck first, where are you gonna get the fat from my BBL? Am I gonna have enough fat? That is a 100% myth, okay? You're going to have enough fat. All right, remember when we do the tummy tuck, the max that we can remove is 1,000 cc's. And we typically only get that from the flanks and the waist. We still haven't touched the central abdominal area at all. We haven't touched the entire back at all. Okay, and of course, if you want to go to different areas like the arms, thighs, we haven't touched that at all either. Okay, so it's not an issue. You will have enough fat. Just take that idea out of your heads. It's a myth. It's false. It does not happen in real life. Okay, so yes, you will have enough fat. Okay, but on top of that, that skin's gonna be nice and smooth and stretched out, which is gonna make the liposuction much better, much easier to contour the body into that nice hourglass shape from the front, that beautiful upside down heart from the back. It's gonna make things a lot easier for us, okay? So definitely, tummy tuck first, lipo BBL 3 to 4 months later, okay? All right, questions?
Okay, we have our first question at YouTube. So it's here.
Oh, very nice. All right.
Yeah, says what causes patient to not wake up from surgery?
Yeah, so a lot of people are worried about or have heard stories about a patient kind of waking up in the middle of a surgery, right? Or becoming conscious in the middle of a surgery. And so that only happens when you're not doing general anesthesia. Okay, so when you're doing kind of like the twilight anesthesia, then that can potentially happen. What's the difference? So when you're doing, so in many centers, they don't want to do general anesthesia, so they'll do things under local and what's called twilight anesthesia. So the local is a numbing medication that they put into the area, and the twilight is basically what we call sedation. So the patient is sedated, but they're not completely asleep. And so if you're being sedated and that sedation kind of wears off in the middle, then you can become conscious and kind of be aware of what's going on, and I'm sure that must be terrifying. But that's why here at Pure we do all our surgeries under general anesthesia. So when you're doing general anesthesia, that means that the patient's put completely asleep. All right, they're not conscious at all. They're not feeling any pain. They're not even breathing. That's why we have to put in that breathing tube and hook them up to the machine during the procedure. And when you're hooked up to that machine, that breathing tube, you're getting gases continuously that are keeping you under that general anesthesia. Okay, so the chances of you waking up and being conscious in the middle of general anesthesia are extremely, extremely low.
Okay, the second question is here at Instagram and says, can a patient choose the shape of her BBL, or is it totally dependent of her anatomy and she can't choose?
So it's a little bit of both. It's a little bit of both, okay? So certainly the patient's foundation matters, right? And when we're doing a BBL, especially in today's age, like our goal is to enhance that very own patient's foundation. It's what we call the enhanced natural look, but it's not enhanced natural to some ideal of what natural looks like. It's enhanced natural meaning to that patient's very own foundation and frame, okay? So we want to work within that frame, okay? But within that frame, there are decisions that we can make. For example, do you want a little bit more lats or do you want no lats at all? Do you want, complete like upside down heart or a little bit more bubbly? Coming from the back into the buttocks, do you want just like a slope? Or do you want, there's actually like 4 options there. Do you want a slope or a shelf, which are the 2 extremes? Don't do a shelf, nobody does that anymore. Or you can do your pokey slope, okay? So it's a slope with a little extra poke to it. Or a slopey shelf, which is even a little bit more there. So there are things that we can tweak, okay? But the key is that we have to remain within, the foundation, the frame of that patient, so at the end of the day, it doesn't look like we just stuck something on there, right? We don't want no diaper booties or ant booties or something that just looks like it just doesn't belong to the patient at all.
Okay, the third question is, do you do lipo and J plasma?
Yeah, so we have something similar to J plasma. It's called body type. So they use the same type of energy, which is RF or radio frequency type energy. It's just two different companies basically. But yeah, we do the body type. We can combine that with the liposuction to add some skin tightening to the procedure. And that's very, very helpful for patients that have mild to moderate loose skin. It's not for the patient that has severe skin laxity. If you have severe skin laxity, in the, say for example, the belly area, then do your tummy tuck first and then come back for your lipo BBL.
Okay, here is the other question. Is there a garment that is worn or required after axillary underarm lipo?
Right. So there's no specific garment there. It's actually a tough area to compress. So other than kind of your normal kind of bras, there's really nothing else or not a lot else that we can do. Sometimes you have these garments that are like, it comes with a bra attached to the arms, and those can be helpful. But all right, and in terms of the bra, of course, you want kind of bra with a wide strap, okay? And that can help some compression, but it's not a great garment for that area. So we really have to give it time. It's going to take about at least 3 months, but sometimes longer, 6 months, 8 months for that area to settle.
Okay. Do you guys do nose jobs? I don't see any pics.
So I don't do rhinoplasty or nose jobs anymore. Dr. Vidal does. She does a beautiful job. So certainly, yeah, if you want to do that with us here at Pure, then our coordinators will refer you to Dr. Vidal. But me personally, I don't do rhinoplasty anymore. I used to, but not so much anymore.
How long are you at risk after surgery for blood clots?
All right, so great question. So we had a whole live last week regarding blood clots, and if you haven't seen it, then I highly, highly recommend you go see that. So you can go to I think it's on Instagram, but certainly you want to go to YouTube. So you go to our YouTube channel at Pure Plastic Surgery, and we'll have that video for you. Went into a lot of detail, about 30-40 minutes just talking about blood clots, okay? But to answer your question real quick, you're at highest risk in the first 2 weeks. The first 2 weeks is when you're at highest risk. After that, it's quite a bit lower, but it's not zero. I would say to be completely out of the woods, probably about 6 weeks. But the first 2 weeks are definitely the most important. Okay, and the closer you are to surgery, the higher the risk. So that's why you can't hop on a plane like the next day right after surgery. You got to be here for at least 5 days. Okay, so that risk starts to come down. Okay, and becomes acceptable only after post-op day 5 for you to then get on a plane and head back home.
Okay. How long is an augmentation with lift procedure?
So typically not too long. So to do a breast lift with implant typically takes us about an hour and a half, depending on the patient, but that'll probably be the average.
Okay. And I want an upside down heart with a slope.
Yeah.
Is that possible?
Yeah, so I think it certainly would be possible. I think for many patients, that type of shape is possible and it fits their frame. It is actually kind of one of my preferred shapes. So I think if you look into our Instagram, you see a lot of our patients that have that upside down heart from the back. Just that a little bit wider in the hips, not so much lats, and then coming in from the back into the buttock, a nice kind of slope in that area.
Okay, Doc, this is at YouTube and says, what's the importance of a patient gaining the maximum amount of muscle in legs and gluteus before a BBL to get the better aesthetics results?
Yes, so I definitely, if you're going to be working out those areas and trying to basically grow the areas, you definitely want to be doing that before the BBL, especially the thigh, because we want to make sure that the thighs is going to be able to carry the look that you're going for. So if you want to have a thicker thigh, so you can then have basically more volume, more projection, and a little bit of wider hips, then you should try to kind of work that out beforehand, and then that way you have a better kind of underlying frame to then create that BBL. In terms of the buttock itself, though, you can certainly continue to work on that after your procedure. So it is one of the exercises that we do recommend. So you can have your BBL, of course, for the first 6 weeks. You shouldn't be doing any heavy lifting or strenuous activity. But after 6 weeks, then you're cleared to head back to the gym. And at that point in time, we do recommend weight-based exercises. And for the buttock, we recommend doing your squats, which can be very, very helpful.
Okay, Doc, what's the ideal BMI for lipo and breast lift?
So I don't go over BMI of 30, okay? And for either of those procedures, probably the top BMI would be 30. And why would I say for a breast lift, it can be 30 or below, and that's okay. What's the most ideal BMI for liposuction? I would probably say somewhere between, somewhere around 25, 26, somewhere around there. But certainly no more than 30. Multiple studies have shown that, or demonstrated that once you start to get with a BMI over 30, the complications rates really start to go up. And the two main complications rate that really start to go up are blood clots and respiratory issues, okay? So that's why I limit my BMI to 30 max.
Okay, so I'm sorry. Do you do butt implants?
So I don't. So I don't like to do butt or gluteal implants. Okay. What's the reason? Okay. So there's a lot. The complication rate is significantly high with butt or gluteal implants. Okay. So number one, you're putting this foreign body, typically they're made of silicone, okay, into an area that's very, very close to the anus, which means that it's an area that is very, very difficult to sterilize, or you can't really sterilize that area. So the rates of infection are quite a bit higher, okay? So this is not like a breast implant. Rates of infection in a breast implant are extremely low, less than 1%, okay? For a gluteal implant, it's much, much higher than that. So, and if you have an infection, then you have to go back, you have to remove the implant. The other issue is that we're always sitting on our butt, right? We're always putting pressure on the area. And so then the risk of a wound breakdown, so that the wound or the incision where the implant was placed, the risk of that opening up and then the implant basically extruding are very, very high as well. And then on top of that, the other thing that happens a lot with gluteal implants is what we call implant malposition, or the implant moves around. So it basically migrates to an area that where you don't want it to be, or sometimes it even flips around completely. Okay, so for all those reasons, I don't like to do gluteal implants.
Okay, this is a patient who's coming the next month for a Lipo 360, and she asks how many
All right.
liters of fat can be removed for Lipo 360.
Great. So
Just
yeah,
remove.
so we didn't get into that. So I said that the lipo limit when doing the tummy tuck was only 1,000 cc's. Okay, but if you're just doing the liposuction, right? You're doing a lipo 360 or lipo 360 BBL, then the limit is 4,000 cc's. Okay, so if you're just doing it by itself, then it's 4,000 cc's here in Florida. Now this is specific to Florida once again. So these limits can be different in different, in other states, certainly in other countries. But in Florida, the top limit is 4,000 cc's of fat that we can remove via liposuction.
Doug, do you do procedures for the thicker legs?
So I don't necessarily put fat into like the entire thigh to make it thicker. But what I try to do is I can put some fat to kind of blend things in. So again, I want the transitions to be as smooth as possible. I want that that contour between the waist and then the hip and the thigh to be smooth. And so if I need to like place a little bit of fat into that upper or lateral thigh area to try to smooth that contour as best as I can, then yes, I will do that.
Okay, is it possible to do fat transfer to the calves?
It's probably possible, but I don't do that. I don't know of a surgeon that does that, but it's probably a possibility. Calves, you can either do, sometimes people want more volume to their calves, and so there are implants for the calves. Again, it's not a procedure that I do, just so you're aware. So there's such a thing as a calf implant, and I'm sure that probably there's some surgeon out there that can transfer some fat as well.
Okay, and do you do procedures on patients with chronic kidney disease or kidney transplants?
No. So remember, this is going to be completely elective surgery in an outpatient office-based surgery setting. So the patients really need to be kind of healthy patients, like completely healthy patients, right? So if you're having any sort of renal failure, then unfortunately you're not going to be a candidate for this type of procedure. If you had a kidney transplant, they're going to be by definition on immunosuppressive medications, and so that's not good for an elective procedure because your risk for infection and wound healing issues goes up as well. So no, unfortunately, if you're having any sort of like renal issues, then we won't be able to do surgery in a setting like this.
Okay, what's the timing between rounds that you can come back for another round? Round 2 or round 3 BBL?
Right. So if you're having 2 rounds of the same procedure, saying you're having BBL round 1 and then BBL round 2, then you want to wait at least 9 months. 9 months would be the absolute minimum. Okay. But of course, if you wait even longer, up to a year or longer, even better. The longer you wait, the better. But certainly not before 9 months. Why? Because there's so much inflammation. Okay, there's inflammation, scar tissue, and things like that. If you try to go in anytime sooner, the surgery becomes really, really difficult. It's very hard to get through the tissues. There's a lot more bleeding, and potentially, it's basically potentially more dangerous to do it sooner. Now, if you're coming to do 2 rounds that are different, for example, your tummy tuck and then you're coming back for your BBL, okay, then the wait is much less. You can do that. You can come back in 3 to 4 months.
Do you do male lipo?
Yes, yeah, we certainly do male lipo. We do male BBL as well, or pretty much any of these procedures in our male patients. So tummy tuck. Probably the 2 most common male procedures that we do are what's called gynecomastia surgery. So that's when there is a bit too much tissue in the chest area, tissue and or skin. So that's a very, very common surgery that we do in our male patients. And then the other one would be liposuction, and that's probably number 2.
Okay, this is another question from another patient, male too. What if a male has more than 4,000 milliliters of fat? Do you do 2 surgeries?
Yes, so that would be what has to be done. So, well, first of all, we got to make sure that your starting BMI is okay, right? So the BMI has to be under 30. But if your BMI is 30 or below and you still have more than 4,000 cc's, then yes, you would have to come For stage 1, we remove, the limit, which is the 4,000 cc's, and then like we just mentioned, 9 to 12 months later, come back for stage 2, where we can remove, whatever else needs to be removed up to 4,000 cc's more.
Okay, what is fluffing stage after BBL? Is it real?
So I believe in the fluff fairy, as they say, and typically it comes in somewhere around 3 to 4 months post-op. And so what is it? What's happening there? So there's a few things that are going on which makes the result much better at 3 to 4 months out than say at 6 weeks out. Okay, so at 6 weeks is where you're actually going to hit a low point. That's when you're losing you've lost a lot of inflammation in the buttock and hip area, but you've also lost a lot of the fat that's going to get resorbed. On average, we lose about 30% of the fat. But at the same time, the waist is still not shrunken in. It still has another good 6 to 8 weeks to go, as well as all the other lipo areas. So then what happens between 6 weeks and 3 to 4 months? Well, that waist continues to shrink in, and then in the buttock area, it starts to soften up and fluff out. Because at the beginning, if you ever feel like an early BBL, everything feels a bit hard, okay, a bit like hardened, and some areas even look like a bit flat because everything feels hardened with all the swelling and inflammation and everything else. So it takes quite a while for everything to soften up, at least 3 to 4 months. So that combination of the waist continuing to shrink in, the areas in the buttock and hips to soften up and fluff out, plus the fact that you have something called stem cells, okay, that are now growing in the buttock area and multiplying a little bit. And then on top of that, you add the feeding the fat, the diet that you do for the first 3 to 4 months. All that combined is what we call the fluff fairy that you'll see later as you progress.
Okay, Doug, how long until you're able to return to work after a Lipo 360?
So it all depends on what type of work you're doing. So for like heavy jobs where you're doing like heavy lifting, strenuous activity, things like that. For example, say our firefighters, police, nurses that are on the floor where they're moving patients around, probably 6 weeks. All right, but other than that, if you're like in the office type setting, working from home, something where you're not just doing a lot of heavy lifting or anything like that, a lot of patients go back to work within 1 week after liposuction.
Okay, Doug, and we're almost finishing this.
All right.
Okay, just 1 second, please. Okay, this one. She's worried. No, this is the last one, Shelly.
Right.
And she asks, I'm worried about the flight home. I will
Yeah.
try to walk, stand as much as possible. What if we absolutely cannot walk on the flight home?
Yeah.
So maybe due to turbulence.
That's right. So that's a very, very good question and a genuine concern, right? So first of all, if you have a flight that's longer than 3 hours, the risk of that happening, where there may be turbulence, there may be issues, you may not be able to get up, and if you're not moving around for over 3 hours, your risk, and you had surgery 5 days ago, your risk for blood clot is pretty high. So for all patients that have a flight that is 3 hours or longer, then we give them, and we highly recommend what's called the Vena Pro, which is a device that goes around the legs, okay, and it keeps the circulation in the legs moving. Okay, the technical term is called a sequential compression device, SCD. All right, so the one that we have here, our brand name is called Vena Pro, and that's the one that all patients that are having a flight over 3 hours must have. Also, any patient that had a tummy tuck must have a Vena Pro regardless of how short your flight is. So if whether it's a tummy tuck alone or in combination like a mommy makeover, anyone who has a tummy tuck will get that Vena Pro. And so what I would tell you is that if you're concerned about your flight and you want to be protected from blood clots, then 100% go ahead and get that Vena Pro device, that sequential compression device, so you can use that throughout your flight and you don't have to worry so much about the other passengers or turbulence or anything else.
And this one down. Do you perform reconstruction on breast cancer survivors?
So I don't anymore. I used to. So before opening Pure, I worked at Cleveland Clinic, Florida, in Weston for about 5 years, and that's essentially like all I did. It was or about 80% of what I did was breast cancer reconstruction. But I don't do that right now. But if I do have a lot of very, very good friends who are excellent at breast reconstruction after breast cancer. So if you want to send us a message, I can refer you some very, very good guys here in Florida. All right, everybody. Okay. Well, I hope that was abundantly clear there. I know we'll still be getting this question because we get it all the time, but I think that makes a lot of sense. Okay, so do not combine your tummy tuck with your BBL, and go ahead and do that tummy tuck first. Okay. All right. Well, I look forward to seeing everyone next week on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.